Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. We are here once again with Dr. Zahra Figueredo. How are you, doctor?
I'm very good, Luis. Always a pleasure to be here with you.
So, doctor, we do have an interesting topic today, which is going to be respiratory conditions, stem cells for respiratory conditions. In this case, what are the most common respiratory conditions that patients have, doctor?
Yes, so we encounter COPD, which can fall, it's sort of an umbrella term for pulmonary fibrosis, usually in the form of idiopathic pulmonary fibrosis, which takes the form of an autoimmune condition, as well as emphysema, which both are considered to some degree as irreversible, and with if stem cells aren't involved. And then we have sort of just the chronic reversible bronchitis type of an obstructive disorder, which is more of an inflammatory condition of the lungs. With the pulmonary fibrosis, we see scarring of the tissues. Many cases, we don't know why it's occurring. It's considered autoimmune, so we have our own immune system and antibodies that are attacking the tissues of the lungs and the alveoli, where it's creating a scarring where the oxygen can't pass readily into the bloodstream. So we have that. And then we also have emphysema, which is usually the cause or the result of smoking or asbestos or some sort of toxin in our environment, which emphysema is the result of, as I mentioned, of these toxins. And how it results is in the damage to the alveoli, the air sacs in our lungs, where the actual exchange of gases take place, the oxygen and carbon dioxide. So when these alveoli are in essence destroyed, the surface area is diminished for this oxygen and carbon dioxide gases to be exchanged. So when that occurs, a person has trouble breathing, taking in that oxygen, and that's the result of emphysema. And all of these conditions can result in possibly habitual use of oxygen, which is one of our key, the key ways in which we can assess the results of our treatment, because often cases we see patients diminish the use of their oxygen.
So, doctor, how do you administer stem cell therapy for a COPD patient?
Or any lung condition, really.
Yeah.
Right? We have a number of different modalities in administering the stem cells, and it's really important for us because our motto is to leave no stones unturned. So we will absolutely do an intravenous infusion of the stem cells, allowing the stem cells to flow everywhere the blood flows, including the lungs. And then we will also do a nebulizer version of stem cells, where we have the stem cells in a nebulized form where they're inhaling and breathing the stem cells directly into the lungs, along with other key factors in lung health in a proprietary cocktail that we have formulated. And we have to ensure that the stem cells are not being attacked by the macrophages of the lungs before they get a chance to do their job. So that's really important that we as a clinic address this in any stem cell treatment, actually, especially for the lungs, because these macrophages can be very detrimental to a stem cell treatment if they are not addressed. And so we ensure that the macrophages are suppressed for that limited amount of time in order for the stem cells to get to the lungs and do their work through nebulizer as well as IV.
And I will have to ask you, what type of stem cells would you use in this type of treatment?
Yes, we do. That's a very good question because in this case, when the autoimmune conditions are involved, like pulmonary fibrosis, not necessarily in emphysema, but in both conditions, for instance, we will indeed use endometrial stem cells, which are coming from a young female uterus, which is very, very effective for anti-inflammatory conditions and autoimmune conditions specifically. By the way, talking about going back to autoimmune condition, we will also apply the stem cells into the inguinal lymph nodes, the lymph nodes of the body, to address the autoimmunity itself. And so we will use endometrial stem cells as well as the patient's own autologous bone marrow stem cells, which we grow in vivo. We have a proprietary method of growing producing brand new stem cells, new, non-toxic. The numbers are very important. So we will do a combination of stem cells.
Can we say that this treatment will also be the same treatment that we will do for COVID patient?
Thank you so much for mentioning that, Louise, because with scar tissue resulting in the lungs from COVID, absolutely. So we'll have a very similar approach. And we will also ensure that there are no viral issues, ongoing viral sequelae, and any other ongoing viral issues with the patient, so we can address that as well with the stem cells. But yes, very much so. We will do nebulizer, we will do IV, and then anything else we feel is necessary for the patient.
And oxygen therapy will be included as well?
Absolutely, okay. Always, yep.
Okay. Doctor, as far as this treatment, how long will it last for a patient to be in Guatemala? Mm-hmm. And can the patient be sure that we can provide all the accommodations as well?
Yes. So in our treatment package, we combine all of the comprehensive treatment protocol, which I've mentioned in past podcasts and videos, including, I'll just mention again for any new listeners and viewers, we have the the total detox program, we have oxygen therapy, we have as well hormone therapy, age appropriate and depending again on the condition, as well as a stem cell enhancement formula. So that will be combined with accommodations. We provide in the treatment package 7 to 10 days of accommodation, depending on what is required for the patient's treatment and condition, as well as a driver, a personal driver to take them to and from appointments. So it takes the worry out of the travel, and it makes it very easy for patients to fully concentrate on their treatment and recovery.
And does the patient have to come back for a second session of stem cells?
Our goal is for a patient not to have to return. The numbers of stem cells that we use, which is very, very significant.
Is it by millions, I suppose?
We are talking about hundreds of millions, absolutely, right, in different modes of administration. So it really makes a difference in the results and whether or not a patient has to return. There are cases, very rare cases, where a patient will see results and we will, they have the option of coming back. We always have them wait about a year to see most of the full effects of the stem cells, because they do take time. Regeneration takes time. And we have them wait, and if at that time they want to come back, they have the option of coming back. However, in most cases, they see enough of a result where we would prefer for them not to have to come back.
Can this treatment work for a patient with lung cancer?
Louise, that is a very good question because I get asked that a lot. With cancers, we do not use regenerative type stem cells, which are mesenchymal stem cells. Those are regenerative stem cells. Those are creating new tissues. Those are creating new cells. In cancers, we do not want to use those types of tissues. What we would use are hematopoietic stem cells. Usually hematopoietic stem cells for a cancer is in a blood cancer. Okay, so hematopoietic refers to blood stems, blood. And in this case, so for many cancers, unless it's a blood cancer, only hematopoietic stem cells would be used, not adult mesenchymal stem cells. So thank you for asking me that question because it's very important.
Okay. So in this case, doctor, for this condition, what will be the day-to-day improvements that the patient will feel?
That's really important for patients to understand what can they look forward to and
Yes.
what can they expect. I have seen firsthand, as I mentioned earlier, a diminished need for oxygen. So patients that are on oxygen, whether it's a habitual 24/7 or if it's only at night, we have, in every case, we have seen the diminished need for oxygen, either no need for oxygen at night anymore, or if they're on oxygen 24/7, they're only using it at night as opposed to during the day. Also, we are finding that the shortness of breath very severely diminishes as well. So they're able to walk longer, endurance is longer without having to use oxygen or without losing their breath. One specific example that comes to mind, or with a couple of patients actually, one mentioned how she was able to walk to her mailbox. She's a patient from the US, and so they have their mailboxes a few hundred yards away.
Yes.
And so she was telling me how she was able to walk to her mailbox without losing her breath and without having to take a break. Another one was telling me about being able to walk the block without losing their breath. So, and then again, the diminished going up and down stairs and the diminished need for oxygen. So a very, very overt response to the stem cells, which is very, very pleasing.
That is awesome. So in case you have any questions, by the end of this podcast, you will find all the information, how to contact Dr. Zahra Figueredo. And I really appreciate your time, doctor.
Thank you, Louise. I always appreciate yours and appreciate seeing you and talking to you.
And I will see you next week.
Thank you so much.
You take care, doctor.
You too.
Bye-bye. Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.